primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Welcome, everybody, to the special edition of My DPC Story. I'm super excited to be returning to the mic with Zach Holdswor, the CEO and co-founder of Hint Health. But also today, we have a new voice in the podcast, and that voice is from Dr. Jamie Baines. She is a DO, and she is founder of Kite Dream Care. Now, something to note about Dr. Baines' practice is that she only opened a year and 2 months ago, and yet she has a full practice, a waiting list of 40 people, and she has already brought on her next doc coming this fall, and she is also looking to potentially hire for the summer, so definitely keep your ears open as you hear Dr. Baines' story. And Zach, thank you again so much for coming back on the podcast. As we have talked about many a time, and I continue to talk about, Hint has been supporting as a company and as the people within the company, the DPC movement since the first day that you guys opened. You really started with something that was helping us as DPC physicians have a tool that helps us be basically an administrative assistant and more, helping us keep track of the finances and our memberships. The mission started with that, and it has continued to grow. And we're going to be focusing on how Hint has grown as a company and how Hint Clinical in particular has helped people like Dr. Baines open and be so successful at practicing DPC. So thank you again so much both for joining us today.
Thanks for having us.
Yes, agreed.
Awesome. So Dr. Baines, I want to go back to the opening days of your practice because I'm wondering if you can share with us, what was your experience opening your own medical practice?
Sure. Well, I mean, it is scary to open your own practice. I had reached a point in my life where I felt like I practiced for 10 years at my group before, and 3 years before that, I lived and practiced in my hometown, and it was just becoming impossible to service the level that I needed. I was seeing 30 patients a day and squeezing everybody in, worked every third Saturday. I mean, I still did inpatient on newborns and peds. And so it was family practice as you imagined it, but in a time where it didn't work. Like the story of most people, I was really burnt out. I was struggling. It was tough. And I had been thinking about it for many years, and it got to the point where one day that was the next choice for me. I think actually maybe the hardest part is like the risk of leaving. I was afraid to tell my patients. I mean, at that point, I'd been with many of them for 10 years, and my coworkers and my colleagues and the other doctors in my practice, to leave was really scary. And almost for me, harder than setting up a practice. And so I started looking around and looking at EHRs and came through DPC groups, just came across Hint, had a meet and greet with them. And they really told me, like, hey, we have this great cohort bootcamp program where it's a pre-enrollment program where for 12 weeks, we train you and teach you and prepare you to open a direct primary care practice. And I was like, wow, okay. Because I don't really know how, I finally found the courage to leave. And now, and at this point, you're like, okay, I can learn things. And more importantly, like I'm with a cohort who's doing the exact same thing at the exact same time. And beyond like how to choose a location, how to like find a lawyer, how to write a contract, all those, like they started with like, what is your why? And that really was impactful to me because really like every decision later, when you're stuck and you're trying to make a big growth decision, it comes back to like, what is your why? And is this moving in that direction? So it started with that foundation, identifying that, like mapping your vision, and then getting into the logistics, which were, beyond it presented in a really creative way beyond, oh, like this checklist. I can read a checklist. There are plenty of checklists on the internet or AI. But when they pair it with like inspiring podcasts and other people chiming in like a weekly group meeting, it was just really helpful. That got me going. And then you can bounce your energy off of the other new people and bounce your energy in your fears and there's just so much emotion. That was what I was feeling the first couple weeks. And then in the launch, by that time I had already gone through 12 weeks of all the steps, collaborating with other people, asking my questions. The launch kind of was okay. I mean, in the journey of anything great, there are ups and downs. And when my furniture didn't come in and I was open, that was a down. But patients understand. Like, you just tell your journey, you tell your story, you say, like, I'm trying something new that I've always wanted to do, and I've always wanted to practice medicine in this way. And I can practice medicine without furniture. I can practice medicine without space, and they're fine.
It humanizes you as a doctor
Yeah.
if you don't have furniture and you explain the story and the why. I think it's actually really cool.
Yeah, I totally agree. And I really love that this podcast is called My DPC Story, because I really think that it is through finding people and connecting with people, even if it's just hearing their stories, knowing that you're not alone is so important in this journey of physician entrepreneurship. And Zach, as we talk about this boot camp and it's helping people from their pre-launch days, I would love if you could tell us a little bit about Hint's launch days, because again, you guys at Hint have gone from this membership management and billing software to including education absolutely through things like the boot camp, as well as Hint Summit that's coming up August of this year. And also, you guys thought about bringing to market an electronic health record that is with continuous feedback from the community of its users. So I would love if you could just zoom us back to the beginning and tell us how we got here, such that you guys are bringing more than just software to the DPC community.
Yeah, and actually, just before I jump into that, Jamie, you may not know this, but when we were launching the boot camp, you were actually, I think, in the pilot version, the
Oh,
first
yeah.
one. And actually, it was something I've been wanting to do for a while. So I was co-creating with a few team members and part of our community. But the version you had was like pretty rough, honestly, compared to where it's got to since that one. But yeah, thanks for being a really great participant, and a lot of your feedback actually made its way back into the newer version,
I mean, it was
which
great.
I don't have anything to do with now because they like kicked me out of the room once I kind of got it going. So yeah, but I think Mario, just to answer your question, when we started the company, 12 years ago, I like to say 10 years because I feel old when I say 12, but me and my co-founder were trying to figure out, like, the system's so broken, and we were entrepreneurs wanting to do something in healthcare to try to fix the system. And whenever we came across a new idea, most of the ideas we had, if you just play them out, they just make the system kind of more, it's maybe they slightly improve the system, but the system's still compounding at 12% a year in terms of costs, and doctors getting less and less happy, and so on and so forth, right? Like, even without a little incremental thing, if you go forward 20 years, the system's just way more broken. And we were trying to figure out what is a concept or a problem we can try to help solve, that if, in theory, if everyone in America ended up with this thing, it could actually fundamentally transform the system from first principles. And we kept coming back to this sort of renegade group of doctors that were doing this kind of very different thing that no one really understood. But and there was like less than 100 of them, and it just like, we kept coming back to it and go, well, it can't be that. And then we'd go look at something else. And then we always just end up coming back to, wow, if everyone had this thing, right, then it actually would fundamentally transform US healthcare. And so that became kind of almost like our mission, is to help enable and power this movement, this direct primary care movement, and help make it the new standard. So that became the sort of rubric for what we do as a company. So one of the things as technologists, we're like, okay, we'd evaluate what tools the doctors were using, and they were using spreadsheets to like manage their memberships at the time. And we're like, well, we could probably do better than that. So we started out with kind of the membership management side of things. And that kind of evolved. Our customers got more sophisticated. They started working with employers. They started running networks. They started scaling, just all sorts of things, but still just down that trajectory of running and administering the sort of business model side of a DPC. So we spent a bunch of time building that out. And we're now, doing, billions of dollars of payments and success on that side of the business. The other thing, though, is with that mission of enabling the sort of movement was part of what this movement needs is kind of venues for inspiration, venues for like collaboration, venues for shared learning, for spreading the word of DPC. And so that was sort of the first Hint Summit. We were like, hey, why don't we bring people from our community together and just sort of see what happens, right? And that became the foundation of now Hint Summit. We think it's the right thing to do because it helps push forward the movement. And I think boot camp is another kind of example of this, where we're like, if we can just, like Jamie said, there's like lots of checklists and stuff out there. But what I think is much more powerful than a checklist is like the shared experience and the shared sort of accountability of doing something with peers. It's the part of university that's actually really valuable, where you're learning with other people, right? As opposed to the actual content, you could probably Google it, right? It's the shared experience. And we're like, well, we've got this, community, can we help harness and bring that to the table? And we've started with groups that are launching, right? But the vision for community is that it becomes a place for, once you've launched as well, it should be really valuable, and as you continue to grow and so on and so forth. So I think that was the genesis for the DPC Launch Bootcamp. And honestly, when we launched it, I told my team, I'm just going to launch this. I'm not even sure if it's going to work. Jamie was the pilot, and people loved it. We're like, cool, let's actually do it properly now and like actually scale it out. So now we're doing a new boot camp every month, right? And it fills up actually as a wait list for it, which is cool. And then to get to your point is around the Hint clinical part of the story, which is what we were finding is historically our strategy has always been, we do the billing and administrative side, but then we integrate with all these EMR partners. And we still actually pursue that strategy today, and we're really excited about our EMR partners. But what we were finding is that it was kind of hard to control our destiny on that dimension, because there are some sort of technology companies in the space just are not willing to partner or not willing to integrate. And it sort of was creating a little bit of almost like a us versus them thing. And we're like, okay, well, what, and it was hard for us to control our destiny on that dimension. So we're like, okay, well, let's continue these really healthy partnerships, but let's also have an answer to this problem. If I'm a DPC that's getting started and wants to succeed, let's create an integrated product that's really easy to use and that sort of simplifies the process of getting started, and really heavily invest in that with a focus on DPC, right? Like, so it's exclusive, sort of really laser sharp focused on DPCs, and take feedback from the community and continue to iterate that product. And that was something that we've been sort of gently being pushed by our community to do for probably 5 years. And we thought we should probably just do that. And so that's why we moved into that space. And so now we're where we are today, and it hasn't always been smooth. There's been some ups and downs, but I'm really excited about where we're at and where the product and that vision is going.
Zach, can you tell us a little bit more about how does one get started with the Launch Bootcamp once they have decided to partner with Hint Clinical?
If you're already a Hint user and have a Hint login, you can just go to community.hint.com, HINT.com. And inside of there'll be links to Bootcamp. If you're already in a process with one of our sales team members and you've sort of made contact with Hint, if they haven't already mentioned it, you can just ask, hey, I'm really interested in Bootcamp, and they'll make sure that you make your way to the right place. If you're kind of new to Hint and you haven't kind of figured out how to get involved, you can either just go through our Hint Clinical page, or we actually have a dedicated page as well for Bootcamp, where you can go to hint.com/bootcamp. And whichever path you go, we'll make sure that you make it into the program if you're interested in it.
And we'll make sure, if you are checking out the blog accompanying this podcast episode, the links will be there, so you can click on those, and they'll be in the show notes as well. So Dr. Baines, I want to turn to you, because one of the things that I think really attracts people to Hint Clinical in particular is the all-in-one solution that people think about, wow, this can help me with And I'm wondering if you can fill in that with blank from your perspective, because you opened as a solo doctor, as a person who had not necessarily been, opening their own clinic before, and yet you have chosen this tool that allows you to do a lot of different things all in one piece of software.
Yes. And I didn't even hire a virtual assistant until like 2 months ago. So it was just me with a full practice. And my husband has a different job that works full time. So he wasn't my secret helper. It was just me. Okay. So yes, it's amazing. Everyone knows that the billing for Hint is like the best out there. The automation of that, it's completely streamlined. But as you said, I didn't want to like float between the combo that people often say of Hint for billing, Elation for EHR, Spruce for communications. And they told me, hey, we are working on building our EHR and this is our roadmap. There had been some roadblocks in it, but each quarter they announce their changes. And now those things are like fully functioning within that system. Then my EHR is tagged into my communications and my text messaging then is integrated into the chart. My patient's email is integrated in the chart. Their billing is integrated into the chart. And it's cost effective because I have like one program. So let me just go back to the startup phase in particular. I quit my job in January. I created a tentative launch date of May 1st. It was free while I did the Hint community cohort of like how to set up a practice, still free. And then the first month was free as well. So that really took a financial burden off my plate where it felt like I had gone to university and I would have paid like thousands of dollars for a college credit course to teach me a business degree. And it was fun. I was so excited because finally we are practicing medicine in a functional way. Like my doctor friends who are still like using Epic and work in hospital systems, I was like, oh my gosh, you guys, look at this. This patient just texted me, hey, I got my same UTI that I get. Cipro always works. Can you send it into my pharmacy that's on file? And I texted back, yes. Sending in right now. That also goes into their chart. It's documented. I just pull up the prescribing, send it in. The pharmacy's already on file and done. Like I don't have to write a note because the text message is the note. And they get a text message from my DoseBot that says, I sent the prescription in because in the past I have said I sent it in and forgot. But it's confirmed, like all the loops are closed. And that would have been like, I don't know, 30 minutes worth of back and forth and like all of these questions. And my other medicine friends are like, oh my gosh, I can't believe it like could be that easy. Or they were laughing because that message wouldn't have gotten to them to the next day, or they wouldn't have them on their schedule to the next day. Everything would have been escalated. Like, I mean, you create your scenario. It's just so practical.
I love that. And I really want to highlight here that it really makes a difference to have a DPC EHR that was built by somebody who understands DPC. And that person has been on the podcast, Dr. Brad Brown. He is the medical officer for Hint Health. He has continued on as it became Hint Clinical. And I'm so glad to hear, Dr. Baines, how your experience has been, put in from dream stage into action. And it's affecting your practice to the point that you just hired a VA and you are already full. So, Zach, I would love to hear if you can share with us stuff that is coming down the pipeline for future users and people like Dr. Baines to use in the future.
When we sort of started working on the EMR project, we quite, as you mentioned, Dr. Brad, who's now a medical director, we acquired their company, and there was a really promising startup that was, seeming to resonate with the community, and we were looking for a path, and so that we sort of came together there. And I'd say when we made that acquisition, it was a very new product, and there was just a lot of foundational work that was required to kind of bring it up to scratch in terms of the compliance stuff we do, the scalability stuff we do, the kind of user experience, the integration with, our core product, the underlying databases. And there's just like a ton of work that had to go in, which, probably users didn't really notice, honestly, what was happening, right? Very much in that phase. And I'd say just because we weren't really doing much customer facing features. We were more like shoring up the foundation. I'd say the primary thing I'm excited about right now is about 9 months ago or something, there was a really big pivot from more like shoring up the foundation and kind of fixing some broken stuff to like aggressively building new capabilities that actually create value for our customers and that are things that our customers are asking for. And so one of the big ones, for example, is like we were using a sort of a partner that was for our calendar system, and it just really wasn't working well, and there's tons of bugs, and we couldn't really control it because the partner was weak and da da da. So we actually spent like 6 months re-architecting and rebuilding from scratch all that infrastructure so that we can control that experience in a way that we want to, right? Create this really clean experience for our customers. So that would be sort of one example of something. We replaced the e-prescribe vendor because it wasn't working out. We replaced the fax vendor, that wasn't working out. We replaced the database. It's just like tons of work we did, which again, like customers will have started to see. But now the stuff I'm excited about is, the big focus this year is overhauling two big parts of the experience. The first is the communications experience. And I'd say where that started was more just making the existing communication system like less buggy and just more functional to do what sort of a customer would expect a comm system to do. Where we're going with that now that we control that foundation is things like the ability to, to deliver care within the actual text message, some of the stuff Jamie just mentioned. How do we, enhance the collaboration between care team members as it relates to kind of virtual communication and things like that? And what are things we can do to kind of really enhance the sort of connectedness between communication and the rest of the charting experience and the data that sits in our EHR. So that's one kind of big area of investment I'm excited about. The other big area is actually overhauling the charting system. So where it started was like quite basic system. Where we're heading with it is like a lot of the work that's just been done is like replacing a lot of the underlying data structures so that we're able to actually have more structured data about what's happening in the charting experience, which should enable us to do tons of really interesting and exciting things in the future, because we now have a kind of a better foundation for charting. And things like reporting and data analytics, things like deeper integrations with other partners that our customers are working with, where let's say there's a workflow triggered on, let's say, a vaccine workflow, for example, or maybe it's a fax workflow. There's some type of workflow that's triggered. The ability for us to have that data, when data comes back to Hint, put into a structured place, and from there be able to do interesting, exciting stuff with that data. And so there's a lot of things that will unlock from a partnerships perspective and from a feature perspective that I'm really excited about. That is foundational work that's been going on in the background that is now sort of coming into the chart. And then I'd say that the other thing is that we've really been pushing towards is a cadence of trying to just release small, delightful things that our customers are asking for, where it might just be small little nitpicky things. We're trying to get to a place where there's basically we call it customer delighters. We're doing 10 or 15 a month, small things. Which, Jamie's probably asked for something in the past. And then I don't know, Jamie, have you got any examples of something you asked for and it just showed up?
I was going to say, that is one of the things I love. Coming from Allscripts, where I had to wait on hold to listen to like a third party help support overseas. Now, I mean, I know all your support staff by like first name, and they sometimes like reach out to me and said, "Hey, what do you think about this new upgrade? Can tell me if there's anything we should improve." And or I'll be like, "Hey, I have to push this button 3 times. Is this just me or is this a bug?" And they'll say, "Oh, thanks for bringing it to my attention. We'll get it fixed." Like next day, button fixed. It's unbelievable. And then I went to the Hint Summit and I was like, "Oh my gosh, you're Jennifer with the PH." Like, because I see their names and I see their profile, and I was like, "You're Jennifer." and we're like, it was so special to like meet the team. You're KT. And be directly involved. And so they, that doesn't happen really anywhere else. So if you want to like make an impact or like help control your destiny, everything that Zach was saying, they make transparent and they ask our opinion every step along the way. And if you don't want to, if that's not your goal, you can just float and reap the benefits. But like, as probably most type A high achieving doctors, I like to give my opinion and have a preferred workflow and structure, and they actually like accommodate that. And I'll even go one step further. Okay, so I've only been here for a year and 2 months. I went to the HIN Summit by myself, didn't really know anybody, and I like everyone. You can go up to everyone. I like went up to Zach and I was like, "Hi, I have this idea. I'd like to like collaborate with some other people about workflows. Um, do you think we could do this?" And he was like, absolutely, like connected me the next day and like created an event, a webinar with the HINT support staff for me to like present my idea and get help. So that like doesn't happen anywhere else, I know.
Yeah, one of the really interesting examples of this playing out was, we were doing, as I mentioned, we were doing some work around kind of re-architecting the charting experience. And part of that was just like redesigning the interface. And so we did interviews with dozens of doctors, and every single one of them wanted a different thing. Like, and we were like, oh my God, what's going on right now? And so what that manifested as is actually the team was like, you know what, we need to put pause on. We actually need to make a system that allows the doctor to have what they want. So I don't know if you can kind of see this, but so what we actually launched was, I don't know if I can screen share, but was the ability to, oh yeah, I can screen share. Okay, yeah. So what we did is what we ended up launching is the ability for every doctor to have the chart the way they want it, where they can just do whatever they want. And like that, we launched that feature, and there's a bunch of other stuff you can kind of do here, and you can add stuff, remove stuff. I want to kind of turn this into a demo, but what we found is we launched that feature, and then within like 24 hours, it was like 90% adopted or something. Because again, like that feedback from the customers about like what authentically they need to like improve their lives. And again, like we really were resisting the temptation. Like we're not going to build something that allows anyone to do anything they want. But almost 100% of people were like, this is what we want. So we're like, okay, well, maybe we actually do have to do that. So that actually pivoted our roadmap. Like we were about to build something else. Like we had designs, we had like we were in a position where we were actually about to start cutting code. And we actually stopped and then launched this before we did the stuff we were trying to do. So that was like a really fast pivot around feedback. We're getting consistent feedback from the community. And that's, I think, the benefit of having such a focused community, because a lot of the feedback you get is consistent and people want the same stuff basically, right? There's just the problem always is you have more stuff to do than everyone combined wants. So we're going through it as quickly as we can. But that's one of the things I'm really excited about, is being able to partner with the community in this way.
I love that. In closing here, Dr. Baines, I would love if you could share with us how you're going to use Hint Clinical as you bring on this new doctor in October and as you bring on potentially another in the future.
Yes. Okay, so I did a lot of thinking about this because, as Zach says, like each direct primary care office is really different and functions different. And while some people bring on like mid-levels and share their patients, I decided we are having very independent, unique, different practices where there's not a lot of sharing of patients. So we decided that the best way was to open another account. So they said, okay, if you want to see everything and have everything grouped as one practice, open it within this way. But we're opening 2 accounts so that we can keep our faxes separate, keep our text messages separate, keep our phone line separate, and then log in as guests to the other persons. And then consequently, it's free while I'm preparing. So for the next 4 or 5 months, I'll load in like all the dot phrases, all like and set, because I've already done this. I don't need to like reinvent the wheel again. I just had to identify what I needed and what I wanted, and they directed me what works best for me.
On that point, I think one of the things that we have, I'd say, tried to kind of instill into our ethos at Hint is, there is a lot of commonality with DPC for sure, especially in the sort of the underlying principles and the sort of why. But what we've seen in practice, though, is there's just like a lot of different variability in how different clinics operate. And so as a kind of a technology company, we've tried our best to enable the system to have the flexibility to operate the way that you want to operate, as opposed to being prescriptive, like this is how you need to use the system. And that I will say that like operating that way does increase the cost of development, right? Like it is harder to build a technology platform that is flexible but also simple and easy to use and can be used in many different ways. Like that actually just introduces complexity. But I think it has been, it's harder to do if you want to also make the system simple to use, right? So there's a sort of a set of trade-offs there. And that's one of the things that we've been, we've tried to keep in the front of our mind. It's like, we're not the innovator here. We're the enabler of the innovator. So like we kind of trying to play that role in the ecosystem, if you will.
Yeah, I had trouble explaining it, but basically I had to identify what I needed and what I wanted and what worked best for my practice. And that was not sharing text, not sharing faxes, not sharing emails, and like have essentially two different systems. And then you told me, okay, this is what you need to do, where there are just different styles. And I kind of thinking it was a lot like, who I thought a lot of practices would be similar. It turns out they're not.
Yeah. And you're actually leveraging one of the capabilities that allows fully separated instances. We've built features that allow you to maintain a single login, so you don't have to, log into many, many different systems and have many different passwords. So that kind of improves security as well. But yeah, there are other ways to do it, right? Like, a lot of the time you just add a clinician and there's sort of permission stuff that you can do that sort of gates information or whatever. But yeah, flexibility, I think, is kind of one of the keys. So.
Well, I am so grateful to both of you. And Dr. Baines, I really loved how you are dreaming and implementing that dream. And I just really think that it is important for people to think about when they're using an EHR, when they're partnering with different solutions out there, to think about where is your clinic today? Where do you want your clinic to be in 5 years? And having a tool that is nimble and flexible enough to help you get there, it's amazing. So thank you guys so much both for being on the podcast today. And I look forward to seeing both of you at Hint Summit.
Yeah. And I'll just close out by saying, Jamie, she's just really engaged and excited about what we're doing at Hint and just really positive. And maybe just an invitation to
yeah, more people. I'm looking for friends. Yeah.
You have some subset of people that are really active and a lot of people watching what's happening. But please, engage. Like, we love connecting with people. We love feedback. A lot of what we end up building is based on the feedback of the most passionate people in our community. So if you have perspective and you want to be involved, please do let us know, because like Jamie said, we live to support, this community.
I'm looking for friends and colleagues and like-minded people who also want to participate and engage. That's what's really special about this. And that's why I'm here.
Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the daily, check out dpcnews.com. Until next week, this is Marielle Conception.